Well, we're here with Dr. LeBlanc from Palm Desert in California. Hi, Dr. LeBlanc. How are you doing?
Fine, Helmut. How are you doing today?
Not bad after Easter here. You know, we had a good Easter going on. Dr. LeBlanc, tell us, you're a dentist. And,
yes, sir.
And as people who are not dentists, we sometimes get the feeling that a dentist is a dentist is a dentist. And I'm sure there's some truth to that because most of you dentists do most of the things. And frankly, we don't quite know what you do anyway. We just simply have to trust of like what you do because we can't ourselves quality control it, at least to a very high degree we can. But still, different dentists have different philosophies in their practice. Some are more towards pure, beautiful smiles. Other ones are towards more functional dentistry. Some do all kinds of work in their practice. Some send out a lot to specialists. And while none of them is probably bad or better or worse, they are nevertheless different. So tell us about your philosophy in your practice, and maybe, Dr. LeBlanc, maybe you'll also tell us what made you become a dentist.
Well, Helmut, to the first thing you mentioned, dentistry is an art, a skill, and there are some that are better than others. There's some that pay more attention than others. It is hard for a patient to understand that because they can't look in and say, "Oh, that's a real nice crown margin there, doctor." What we do here at Portola Dental, we are a general dental practice. We do most everything. We do the cosmetics, but our thing is preventative, taking care of people. You might say that, we treat people the way we would like to be treated, but we go a step beyond that. I believe you should treat people the way they want to be treated. And the only way that you can find out how they want to be treated is to talk to them and understand where they're coming from. Different people have different needs. Different people have different philosophies on what they want for their health. So the first thing you'll find here at Portola Dental is that's what we do. We figure out what they want because in the end, they are the boss. They are coming here for our services and professionalism. And until I understand or we understand what they really want, we can't decide what we do for them. And in the end, we don't decide what we do for them. We counsel them and they get to decide what way we get to help them.
So basically, you're not enforcing a Julia Roberts, Tom Cruise smile on everybody because that's not necessarily what they might find important. Just like not everybody finds a Mercedes or Maserati an important thing, whether they have the money or not. And then again, other people might want to have a Mercedes or Maserati when financially they have to really struggle for it. But so basically, if that's what they want, nobody should really tell them that they shouldn't try to go for it.
Correct.
Yeah, but at the same token, let's just say a person doesn't want to fix his gum disease because he feels that falls into the category of having a Mercedes or having a Toyota. Will you let him know that, no, that doesn't quite fall into that category. That more falls into the category of you living or not living down the road, or at least living with quite some danger of getting all kinds of other illnesses or not. And you'll be slightly more insistent to get them the functional dentistry. Basically, you will educate them till they understand. The way a parent, I guess, has to do it with his children. Not just what do you want, but okay, what do you want with a mixture of what do you need?
Well, sure, Helmut. There's no one way for everybody. I've been at this 23 years. I got out of USC in 1988, so I've seen a lot of people. I've been practicing here in Palm Desert for those entire 23 years.
You look pretty well kept, I have to say, for your age. You've
got to come to Palm Desert more often. It is the fabulous life we live here that lets us just exercise in the beautiful sunshine every day. But yes, I really never try and get on a soapbox to scare people. But yeah, they're putting things together where gum disease does have a systemic issue to it, where if it's really bad and the bacteria is getting into your system, it can affect the heart. They've talked about pregnancies, things and that. I don't like to scare people, but you know what? healthy teeth really enable you to live a fun life. When you go out to dinner with your family and friends, you don't want to be thinking, oh, gee, I can't smile, I can't chew, I am in pain. You just want to have fun.
Sure.
And we try and educate people on how they can be as healthy as they can possibly be.
Sure. What made you becoming a dentist?
Oh, Helmut, that's a long story, but I started thinking about it when I was 5 years old.
Really? That early, huh?
Yeah, and I've just, it just went through, and I did a lot of office observations as a teenager. And fortunately, I was, my educational prowess was good enough to do what I wanted to do, and here I am.
Great. It's great. It's always amazing to me that people, well, maybe I knew it at 5-year-old. Maybe I did at least very early know that I wanted to become a mechanical machinery engineer. The only thing with me was the second I got my diploma, literally the second I got my diploma, well, give or take a month or two, I quit that profession. Never to be having touched it ever. And you're still...
At least you didn't go into dentistry, Helmut.
Well, as you said, you have the Palm Desert life there. You don't seem to be doing too bad, and you seem to be enjoying it. Because as you at the beginning mentioned, I've definitely noticed that dentistry is one, and so are most professions, but I think in dentistry it becomes more clear is, yes, there is down to the millimeter technique, science, and how and what to do. But then there's that art because you see it. And even though a tooth may have all the mechanical and physical structure the way it's supposed to be clinically, there's that missing to make it just like a pretty girl. She's pretty, but for some reason that other pretty girl gets all the eyes. You know what I'm saying? And I think with dentistry, it's the same thing. You gotta put art into the clinical perfection as well. Would you agree with that?
I would agree with that. It's an art form, and it takes a lot of practice, and you have to be, like everything else you mentioned, there's a lot of different professions where if you're into it and you enjoy it, of course you're going to do a better job at it. And of course we get paid for what we do. But, just the results, we dentists, because people can't really see what we do, we have to kind of sit back at the end of the day and say, boy, that was a pretty good day. Unless we're doing a cosmetic case, the people that we worked on that day, they don't really know. But I think after 23 years, if you would talk to all the patients that we've seen over that time, they just have a feeling when they come in our office, and it's from the time they call. We really have a caring staff. We go with referrals more than anything else, and it works out very well with us.
Beautiful. Thanks for letting us know. We're going to do a couple of more interviews talking about procedures and what and, consequences of people doing or not doing certain work, and about the improvements which happened in dentistry over the last decade or two, which, we think that only computer had improvements, but, even if that is so, those computers have helped you guys and in the patient quite a bit. Thank you very much, Dr. Leblanc.
Definitely.